seconds. Here we go. Okay, we're live. Okay, we're back. Usually we chit chat, Kim, but Laura tells me we're better just to dive right in anymore. So we're
All
gonna say
right.
that.
We're
So
ready.
welcome everybody. We're back. The second. So we're MedTech Reimbursement 401, the advanced course. This is the second session. Actually, Kim Norton, who's joined me again today, and I got to tell you, guys, I have learned so much from Kim. Kim's the CEO of JDL Access, but I've learned so much from Kim. You guys are going to learn from her. You guys are going to learn a lot today too from Kim. So we're just blessed. You guys, we did the first session with Adi Renbaum where we kind of talked about reimbursement pre-authorization before you get FDA clearance. What Kim and I are going to focus on today is post-authorization. So Kim, first of all, thank you for joining us. Welcome back.
My pleasure. So glad to be here again.
I'm glad you're here again too, obviously. So just a reminder to everybody that's joining us today, if you have any questions or comments, drop them in the comments, and if we have time, Kim and I will respond to them. We'll try to weave it into our discussion. So let's kind of set the stage. Okay, we talked the last time with the D up until authorization. So now, you've got FDA authorization, which obviously is a huge milestone, but it's not the finish line. And I figure we'd use a football analogy. It's appropriate time of the year for that. So,
oh yes,
the analogy is really, people tend to have big celebrations, and it's a big deal. It's a big milestone. It's announced to the investors, FDA authorization. But to me, you're just on the 10-yard line. And I don't mean the opposing team's 10-yard line. You're on your own 10-yard line. You still have 90 yards to go to success. So let's dive right into this. And you brought this up, Kim, you kind of inspired this whole discussion for this series when you said something around the comment. We were chatting around doing one, and you said, when sales and reimbursement don't coordinate on the launch of a technology, that's a big challenge.
Yeah.
And you're the first person that I've ever said anything like that, how integral those two things. So can you kind of tell me what your thoughts are around that? And from the direction of if sales and reimbursement are not aligned, what can happen? Like, what's the bad stuff?
Yeah, no, it's a great question. And hopefully you will have worked with, the company will have worked with somebody as wonderful as Adi beforehand.
Yes.
Have the right strategy, be working toward getting a new code if that's needed, coverage, payment, all that good stuff.
Yeah, but I think the other thing we talked with Adi about, which was really good, was integrating not the reimbursement strategy into the clinical development strategy as well to get the data to support reimbursement and the economic side as well as just the clinical side. So
exactly. So it's so imperative. So then you're now launched, right? You're on the market, but you're in that, I call it the canyon of death. It's sort of not a great term, but that is where a lot of disruptive technologies go to die, because even if you've done the work before, right? The reimbursement stuff, the CPT codes, the HCPCS codes, all that good stuff, it's still going to take time after you launch, right? You're not going to have it day one, typically.
Yep.
So you've got to work through a year, 2 years, maybe 3 years, maybe 4 years of not having that in place, right? Yeah. It can take time, especially to get a CPT code. You may have a category 3 CPT code, which is kind of, emerging technology. Yep. But to become a standard of care, if you are truly disruptive, really takes anywhere from 2 to 6 years. It's a long process. Yeah, it's a long process. And hopefully it's faster, but these things take time.
That's kind of like a period of turmoil around the reimbursement, right?
It is. Absolutely. Yes. Right. And if you have a strategy, that strategy might be you're using a category 3 code, you've got some data, you're using an unlisted code or miscellaneous code, you've got,
Yep.
a little bit more data, whatever it is.
So Kim, let me ask you, can I ask a quick question here? So you come out and you're using category 3 code, and you've got a pretty disruptive technology that's really, there's no reimbursement that's really established around it all. How many patients can you expect to get reimbursed for coming out of the gate like that? 10%, 50%, 90%, what, or zero?
Assume none.
Assume none. Yeah.
Assume none. No, truly, if you're planning appropriately, assume none, and then work toward, you're going to get maybe 75%. I think it's feasible to build up to 75, 80%. And the
what period of time though?
Couple of years.
Okay, yeah, right. So it's not 75% 3 months out. It's
no.
It's 3, 4, 5
it takes
years
time.
out.
It takes time. Exactly. So if you haven't planned for that period, and we can talk more about things you can do to make that period really successful, then what's going to happen, and I've seen this happen time and time and time again in my career. The company gets FDA approval or clearance. Great. Like you said, now you're on the 10-yard line. They may even have a reimbursement strategy, but they have done maybe one or two things wrong.
Yes.
One is they have modeled their sales too aggressively, right? So now once those realities start to hit, the board's disappointed, the shareholders are disappointed, all that stuff, rather than planning it appropriately around that timing around reimbursement. And hopefully it's even better than that, right? I'm using worst case scenario.
Yep.
The second thing is hiring reps that are what I would call sort of traditional medical device sales reps who are used to selling things that are already established.
Yes.
Great. They're really good at it. They're amazing, but it's not a disruptive technology per se, right?
Yes.
And maybe haven't dealt with reimbursement and haven't dealt with all the issues that go around that. So those two things are critical. If you plan that appropriately and there's a reimbursement strategy and the reps understand what the strategy is and can be the voice in the field to help connect those two things, then I think you can be successful.
Wow. And when you say aggressive, well, let me ask you this question. Give me an idea. Well, no, let's not go there yet. So I want to hold that question until a couple minutes. We'll talk about that in a minute, Brown. Well, but so this idea of over aggressive on the revenue model, and I kind of equate that to is setting the wrong expectations for everybody.
Yeah.
And then the other thing I will say about that is the reps, having the right reps. I think on the other piece of that is having the right sales leadership, because I think you have the same problem. I think you have the same problem because they're the ones who are setting the expectations, managing along with the CEO in these situations, or managing the expectations. So let's talk about these setting expectations a little bit. And that's a big one. So I think, one is it's challenging to set expectations for a product launch anyway. Right. And it's really challenging from a standpoint of a disruptive technology, because I think you have two pieces going on. One is the reimbursement piece, which is going to impair your ability to sell, right? Mm-hmm. And then the second piece is, just launching a disruptive technology. The sales piece is really hard to figure out too.
Really hard.
And I don't want to dive into the sales because we talk about that a lot on here. But let's talk about how do you set expectations around this long-term reimbursement strategy? Can you give me an idea of how you do that?
Yeah, I mean, I think what I see often is companies planning for sort of that revenue stream that goes like this right away.
Yes.
Right?
Yes.
A year from now, we're going to be like this.
Yes.
And I think with the challenges of reimbursement, if you don't have realistic expectations around that. And the one thing I would say is I think it's super helpful to have a reimbursement person on your executive team
Wow. Yes.
who integrates with sales and marketing and clinical and plans all of that appropriately and has a voice at the
Yeah.
table who says, okay, I get the pressure. I get that you need to have immediate sales. Why don't we think about alternative markets, right? Maybe the commercial payers aren't going to adopt this right away, but maybe there's a workers' compensation audience. Maybe there's cash pay. Maybe whatever it is,
Got
right?
it.
You have a plan so that you can ramp sales, but they're not going to be so aggressive that you're going to disappoint people.
Wow.
But
So th-
rather set expectations lower and
So
be
this
satisfied.
really this integration between the reimbursement strategy and the sales product
It's
launch
huge.
strategy is
That's
really the more you're talking, and I agree with you 100%. I think these are the two. This is where most your risk lies with
yeah,
launching a new technology, but and in both those areas, but how they work together, because figuring out what those alternative markets, that's probably more of a sales role than it is a reimbursement role.
to some degree, but they may not even know those markets exist,
Yeah.
right? I mean, a lot of people don't think about work comp. A lot of people don't think about whatever, personal injury, whatever it is, that depends on what your technology is
Right.
and what
Right.
the what
Yeah.
the what the payer market is. And I think people think commercial payers and Medicare, and that's it. There's
Yes.
a lot of other, types of health plans out there. There's Medicaid, there's Medicaid managed care, there's, you
Yeah.
name it.
Right.
There's other ways to get
But
there.
there is this workers' compensation play. There might
Yeah,
be this, in certain specialties, you can do the cut, direct to patient
yeah,
pay.
right,
You got, that probably won't work in cardiology because
right.
that's practice, but it will work in ophthalmology and plastics and that type of thing.
Yeah,
But the point being is, man, you better be planning for this early. You got to be managing expectations early, and managing expectations so they're realistic. So, I mean, the worst thing that can happen almost is set an expectation with with
yeah,
your board of hitting these numbers, and then coming in woefully below them. And
exactly. Exactly. So I think part of it's being realistic, and then it's hiring the what do you call them? The Renaissance reps?
the Renaissance reps.
Yeah.
So tell me, I talk about that a lot on here. So tell me your thoughts around that, Kim. I want to hear your ideas. What do you think the right Renaissance rep looks like?
Well, I mean, I think
Well,
first of all, just obviously has dealt with a disruptive technology, has
yes.
dealt with the fact that maybe there's not established coverage and payment already, right?
Yep.
And again, to your point, you not only have to sell a physician or a facility on a new technology or a new
Yep.
procedure, but
Yep.
now it's, oh, and also it might not get paid.
Yeah.
And supporting them through that. Now, you don't want your reps getting intimately involved in reimbursement. And I'm going to do a whole nother webinar later this fall with an attorney talking about
Mm.
keeping those things separate. It's imperative to compliance and everything else.
Oh,
But
really? So the rep,
yes, absolutely.
you don't want
No,
them actually advising them on how to bill and all that
no,
type
no,
of
no,
stuff.
no, no. I mean, this shouldn't be about, anything to do with inducement or anything
Right.
like that, right? You don't
Right.
want to say, "Oh, for this, I'll give you that." And let's face it, that's just that. Hopefully, that doesn't happen
Right,
in this world.
but they just that piece you're starting to talk about, most reps don't engage practices around reimbursement at all.
They
It never even shows up on their radar in a
no,
sales.
they don't because they're afraid of it. And to
Yeah,
my point about compliance, they should be afraid of it, right? We don't want to go there.
right.
It should have nothing to do with the sales process. But what should be part of the sales process is, doctor, this doesn't have a code, or it's not covered, or it's not
Yeah,
paid.
right.
There's a I don't understand it,
Yeah.
but there's a resource that can help you understand it. I'm going
Mhm.
to introduce you to that resource, and then good luck, right? So
Right.
you make the decision clinically, is this the right technology for you? Do you have the right patient population? You
Right.
know, they may ask some general questions about payer mix just to be able to tell the reimbursement people,
Yep.
here's generally what this office sees. It's a lot of Medicare, it's a lot of commercial, whatever. But then it's reimbursement resources. Just turn away and leave it with the reimbursement people.
Yeah,
But you got to have those resources.
Well, first of all, you got to have them, but also and this is one of the challenges with disruptive product sales. Part of the sales job, and the way I train my clients to work around selling in the States is when you're launching a disruptive technology, the sale doesn't close when you actually get the customer to buy, the doctor to buy it.
No.
To be successful in a disruptive technology, you have to take it from what I call the happy buyer to the satisfied customer, which is working through this reimbursement stage. So, I mean, just like a scenario, you launch the product and you've got your first docs, but you're only getting reimbursement on 25% of the patients. As you progress over time with that doctor from 25 to 50 to 75 to 100%, managing the expectation of the clinician, the practice, their patients, managing the pushback from patients when it's not getting paid, and that all becomes critical in the sales process.
It does. And if you pretend like it's not going to happen,
yes,
here's what I see happen. The rep goes into the account. They talk to the physician about the technology, do a great job selling them on the technology. Physician adopts it, decides to use it.
Yeah.
They do 2 or 3 procedures, and in about 30 days, they realize, oh boy, this is not getting paid. And now I'm done. So now you have put all these resources toward training the physician, training the office, getting the device in there, doing all those important steps, and then 2, 3 proceders in, you're done.
Yeah, and the physician says, I'm getting all this pushback from patients,
Yeah.
you're not getting paid. I've not got to bill them. And yet now instead of the patient have a $100 bill, they have $1,000 bill.
Yeah.
Type of thing. And now you've closed that doctor, and now you've lost them. Yeah. Not only have you lost them and wasted all the upfront time getting him on board for disrupt technology, which is the hardest sale in MedTech. You've got negative branding in the marketplace because now he's bad mouthing your company.
Exactly. That's even worse. And now you can't go back.
Right? Now you can't go back. Yes.
Yeah. And so now you have a bunch of people that you have left in the dust, and it's not a healthy way to launch a technology. So I think being realistic, if you have a Renaissance rep, number one, they're educated about what the reimbursement challenges are. They're realistic with the physician. That's going to be hard.
Yep.
Have you dealt with this before? Right. And so another part of it is finding the reps who understand how to identify the right accounts. Have you dealt with this before?
Yes.
Right?
Yeah, and you've got it, and this is unusual for reps, but I do this when I'm selling to finding the right customers. Who's that early adopter? Who's going to go through this learning process with you?
Yeah.
Because you're learning how to sell it, you're learning how to deliver it to the patients, but you're also at the same time, as we're talking about here today, you're learning the reimbursement process and building the reimbursement process over time.
Yeah.
And that takes a unique company. It takes a unique sales rep. It takes a unique customer to do all those things effectively and come out and build. So this gets back to the earlier conversation around expectations. We set this, bad scenario. You set this high expectation. We come out, we're pushing product into the marketplace. So we then go get 10 doctors. We don't go through this learning process around reimbursement. Out of those 10 doctors, 8 out of 10 of them, you don't get the right reimbursement, and they stop using your product, right? And they stop using your product. So now you don't have reference sites. And now you take a high expectation that gets mismanaged and actually create a bigger problem than if you had, you just create a bigger problem.
Well, the curve starts to look like this, right?
Yes. Yes.
It's not healthy. It's not a great way to do it.
And
So
honestly, for what you and I are talking about, the
yeah,
curve doesn't look like this. It looks like this. It looks like this. It looks like it's a rough stage that early on. It's kind of a
yeah,
bouncy one. What you don't want to present is that drop off where you
yes,
really disillusion your customers, the market, and that's everything, which is what we're talking about avoiding. And the thing that, and we talk about this a lot with agile market entry, but what we don't talk about is this piece, the piece
yeah.
of reimbursement before, which is this is so critical, Cam.
Yeah, no, I'm so glad you're talking about it because I just think it gets kind of de-emphasized, and I think I mean, it sounds a little, self-focused when you're talking about reimbursement, and I'm a reimbursement person, but I think it's the most important thing,
Yeah.
right?
Yes.
It at a launch, because if you haven't thought about who's ultimately paying,
Right.
you have missed a whole customer segment.
Yep.
And I mean, you can train a lot of people, but if they only do 2 or 3 procedures, you're going to run out of people pretty quick. And now you don't have an audience. And it's really hard to go back and say, we didn't do it quite right. Let's regroup.
Well, yeah,
Right.
that's a launching a disruptive technology is probably one of the hardest things to do in business. Period.
Yeah.
And if here's your starting point, you got to climb a mountain to be successful at it. When you launch and do what you're talking about, create a lot of churn and create a lot of bad mess branding in the marketplace. You actually lower your starting point
Yeah.
to a more challenging place. And as you said, it's almost impossible to start over again.
Yeah. As opposed to being realistic and saying, okay, this is going to be hard. It's just going to be hard. And you're the right person to work with because you've done this before, or, your office staff is incredible. They know how to help us deal with this.
Yep.
We'll work with you. We've got resources. There's ways to do this that are upfront, honest, and can be successful, right? And so if you
Yep.
bring those resources to the table and the reps understand what the resources are and how to talk about them,
Yep.
then and when to step away from the picture, then I think you can be
Yes.
very successful. But if the rep doesn't want to slow down and take this process all the way through and really be patient and pull it through ultimately, then I think it's not the right rep.
Yeah, I almost think that's the biggest issue of all here, Kim. It's
I
it's
do
the
too.
it's the mindset of the leadership, first of all, and managing those expectations appropriately, which
Mhm.
we almost never happens. And then the next step is making sure you bring in the right the type of sales rep that
Yeah.
can operate at this stage, this Renaissance rep that's going to deal with the ambiguity, that's going to have the patience to
Yep.
nurse their, can close deals, right? So they've
Yes.
got to be the hunter, but they also have to be the forager too, because they then have to nurture those comes through. So this is a novel stage of product development, market development, and it's novel in the leadership you need, and there's also the sales force you need. And the third piece we talked about briefly is your customers are novel too. You got to pick
That's
the right
right.
customers at this stage.
That's 100% right. They have to understand that they are early adopters. They're going to be in this chasm with you,
Right.
and they're willing to do it,
And they
right?
got to be one. Yeah, that's right. And they also have to be a bit visionary because
Yes.
they've got to be able to see the upside of them making. Everybody has to make this type of investment to be
Yeah.
successful.
Yeah.
And it's one of
Absolutely.
those times where you really do have to slow down the speed up. Because
Yeah.
if you push, then you go up, you hit, and then you drop off and you kill yourself. If you're successful at that, you go up, you struggle along and you work your way through all this learning you have to go through for everybody across the board. And then you get to the repeatable process that then you can scale against.
And I tell you what, at every company I've been at,
Yes.
I can pick out pretty quickly the handful of Renaissance reps that are going to work with me. And they are always, always the most successful. They're all the ones I keep in touch with.
Yeah.
They are all the ones who wanted to understand it, learn it, be able to talk about it with their providers, be able to understand what the providers were asking or
Yeah.
saying or complaining about or facing. And I think finding those for those types of launches is so critical. And then they know how to identify the right providers, right? They've worked with them, or they've got a menu of things that they're looking for.
It's funny. I've had the pleasure over the years of working with those type of reps, and I
Yeah.
agree. Being able to select them, you can pull them in and out. A lot
Yep.
of times, those reps don't know exactly what they're doing. It's just kind of who they
Yeah.
are. But
Right.
there's this piece to it. One is this curiosity piece.
Yes.
One is this piece of looking at the bigger picture and solving the puzzle piece. Most reps, and then the other one is this idea of thing I find is they're almost more concerned about their customers than they are about themselves and their company, because they're
Yes.
looking. Because to be able to do this successfully, you have to figure out how to create success for your customer before you're ever going to be successful. So but I talk with a lot of these reps when I've had the pleasure of working with them. A lot of them don't realize even what they're doing. So a lot of times they don't know this
They
about
don't.
themselves.
They don't. But you can figure out pretty quickly that they're going to engage, and I love that. I just love that process of working with them.
Yeah.
Do you want to talk a little bit about the resources that I think are important, though?
Sure. Sure.
Yeah. So, I mean, here's what they've got to have in their bag. They've got to have somebody back at corporate or somebody out in the field that they can say, you're going to have problems, and here's your resources, right?
Yes.
Here's a coding guide, or, we'll help you understand what the coding looks like. Obviously, it's your purview position, but, here's some guidance. Here's
Yep.
what we've talked to the societies about, et cetera.
Yep.
And then I think it's either having feet on the street, so people who literally ride with them, who
really?
go in after them and say, okay, great, I'm glad you're adopting this. Let's talk about what this process is going to look like.
Got it.
And what you're going to face, and what the different payers say
Got it.
around coverage. The ones that cover it, the ones that don't, what the criteria are,
Right.
All that stuff. And then I think making sure that you're keeping the pressure through not only utilization, because here's the other thing that's so important about this is if you do that churn that we talked about, right?
Yeah.
You go in, you train, you do 2 or 3, you drop off. The
Yeah.
payers aren't seeing any pressure. They're not seeing utilization. They're not seeing claims. They're seeing this doctor maybe submitted 2 claims and I never saw them again, or they're not seeing the volume of claims that they need to start to realize this is a real thing.
Yes.
We should take it seriously. We should think about covering it. And that takes time, and that takes volume and utilization, but it also takes pressure.
Yes.
And the way to create that pressure is through making sure that the patients have access to the technology by not allowing the payers to just say no.
Yes.
Because if you have a category 3 code, almost always, unless you've negotiated some kind of coverage, the immediate answer is no.
Yes.
No, this
They're
is an
gonna deny
emerging
it.
technology.
Right.
You don't have enough long-term data. They can already just say that out of the gate.
Wow.
So what do you just leave it? No, you fight it. And the way to do that is patient by patient by patient, and making sure that you're supporting each of those cases so that ultimately you get some coverage, and now you start that process. Okay, we got a little coverage here, a little coverage there. Payers start to develop policies, and within a few years, your standard of care. That's what it takes.
So Kim, this is brilliant. You and I haven't talked about this, but this is
I wish I'd made it all up.
What's that?
I wish I'd made it all up, but I didn't.
No, I get it.
It's just the reality.
But we almost are self-destructive on the way we launch products.
Yes.
Because, so especially when it's disruptive, we have to get it, and we have to drive adoption by the payers as well as our providers, right?
Mm-hmm.
If we're going in and we're doing the typical sales where we got these high-powered, killer reps that are going in, closing deals and moving on to the next deal, closing the next deal, closing the next deal, and we create this churn in the marketplace, it actually supports the payers in not coveraging. Because we take the pressure off before we ever get them change their behavior.
That's
And
right.
the only way that, and this is one of the things I've learned from you recently, and this is brilliant, is the way you apply this pressure is through this denial process, and then the appeals to the denial and forcing the payers. And if you don't consistently have successful providers working with patients to continually put that pressure on, you're never going to, your reimbursement strategy will never work, is basically what you told me.
Totally. Right.
So
It's a rare one that gets through without that.
What's that?
It's rare to get through the chasm without that.
Yeah. But
unless you've got a lot of other alternative channels that keep you afloat.
And it gets back to the very first conversation we had, the expectations on the front end around launching technology and the way we typically do it, it actually defeats both the sales process, right? Because the problem I have is that we're pushing out selling, we're not discovering the actual sales process that's going to lead to growing success over time, which is discovering the repeatable sales process. Well, what you're talking about here is discovering the repeatable reimbursement process.
Yeah, no, that's a good way to put it. Yeah.
And if we don't, and this expectation early on of hitting the ground and having the revenue ramp right away actually prevents us from having success. It actually creates that consistent drop off that we see over and over again in the launch of technologies.
Yeah.
That's I'll tell you, that's the one thing that if leadership, if investors got that concept, if the leadership of the CEOs of these companies got that concept, and the leadership on the sales teams and the marketing teams and the product development teams, if we actually embrace that concept and figure that piece out, we would literally change the success rate of our launches of medical device technologies.
Couldn't agree more. I think you should just leave it at that. Brilliant.
I know that's the challenge, but that's the message that, and because of the way we're wired and the way we work, and I see this in sales, because the way we work in sales now, we prevent us going through the learning process on both those two pieces, which are by far our greatest risk in the launch of a new technology. So, wow, Kim, that was killer.
No, it's a great discussion. I mean, I so appreciate your perspective too. And maybe at some point we should bring on one of the Renaissance reps and talk to them about what they learned and how important it was for them and all that stuff. I think it'd be helpful.
Good idea. Okay,
yeah.
Let's figure that one up next. I'll do some hunting and find someone I know that fits that role, and we can have that discussion.
Great. Look forward to it. Thanks, Chris.
So you're welcome, Kim. So just wrap it up. Let's leave it at that, folks. Just our next session is going to be September 25th. It's a Thursday, and we're going to have another second time, person coming back. It's going to be with one of my current clients, Brian Jamison, with Diagnostic Biochips, and we're going to be discussing. And this one's going to be really fun too, Ken. I've been working with Brian for over a year now, but we're going to talk about how do you find your market entry point, or your beachhead market.
Your beachhead, yeah.
How do you find your beachhead? And this one's going to be fun because this is going to be another real world example where we talk exactly what we're doing at Diagnostic Biochips, and past we went down that worked, and then that didn't work, and then how we to pull back and readjust, and in search of where we're going to enter the market from. And this
great, love it.
We have. So, Kim, thank you so much for joining me again. This has been wonderful.
Thank you.
And, everybody, enjoy your rest of your Thursday.
Bye.